Studio Bovine today we have Mark Crawshaw from, he has a veterinary practice in southwest Scotland. Welcome in the studio. You've been investigating pneumonia in adult dairy cattle. Why did you decide to do the investigation?
Well, in my practice in southwest Scotland, we see a lot of clinical cases of pneumonia in adult dairy cows. And also, if you look at the published literature on pneumonia in adult dairy cows, although it's fairly sparse, it would suggest it is a significant problem in many dairy herds, and there's very little investigation being made of it. So I thought I would like to investigate the cases that I see in more depth to see if we could find the cause of the pneumonia that we were seeing.
What did you look for?
We looked for acute cases of pneumonia, which it was possible to take samples from, and we tested the animals for the viruses that cause pneumonia, the bacteria cause pneumonia for lungworm, using bronchoalveolar lavage samples and nasopharyngeal swabs, and we also did paired serology for the respiratory viruses and for the BVD virus and for Mycoplasma bovis.
So you tested on 15 cows, right?
We tested 15 cows on 10 different farms, yes.
And what did you find?
Well, we found very little, unfortunately. We found, in 2 cases, we made a diagnosis of bacterial pneumonia. One was Mannheimia granulomatus and one was Mannheimia hemolytica. In the other 13 cases, we made no diagnosis at all, but I must emphasize that we were only testing for known pathogens using routine tests. But we failed to really answer the question as to what was causing these pneumonia cases that we were seeing.
So do you have any ideas what it could have been?
Well, I think there's 4 possible reasons for not achieving a diagnosis. The first one, which shouldn't be underestimated, is the possibility that these weren't actually cases of pneumonia. Perhaps there was another disease syndrome. There are other factors that cause elevated respiratory rate in cattle, such as pain, pyrexia due to an infection in another body system, heat stress, or even subclinical hypercalcemia. So that is a possibility, that there's a wrong clinical diagnosis and these weren't cases of pneumonia. The other possibility is that perhaps there was inflammation in the respiratory tract, but it was a non-infectious cause, such as an allergic reaction. The other possibility is that conventional agents were present, but the laboratory tests that are in use are insufficiently sensitive. And finally, the other possibility, which at the moment I think is the most likely, is that there are a respiratory pathogen, or there are respiratory pathogens out there causing pneumonia that we don't routinely test for, that we don't know about, or we assume are not significant causes of respiratory disease in cattle.
What would be your recommended next step?
I think the next steps to progress this would be to investigate more cases alongside a confirmatory test that the animals actually do have pneumonia, such as looking for inflammatory cells in a bronchoalveolar lavage and/or ultrasound scanning of the thorax, and to cast the diagnostic net wider and look for unconventional pathogens, look for using advanced techniques, pathogens we don't even know may cause respiratory disease.
Yeah. Do we have to be worried?
I don't think it's a condition at the moment that is going to cause a massive epidemic and kill a lot of animals, but for individual farms it is a significant cause of production loss and culling. And I think the other thing we need to be wary of is assuming that cows that we see with respiratory disease are suffering from IBR, for example, because I certainly didn't demonstrate that, and I think I would have done because the tests we have for IBR are fairly good. So I think the veterinary practitioner needs to be a little bit more open-minded as to what the causes of respiratory disease might be in the cows that they're seeing. It's not necessarily going to be IBR or lungworm or a conventional disease that we know about.
Exactly. Thank you for your insights.
Thank you.
Thank you for watching Studio Bovine, and hope to see you again.